In 2016, widespread 20 miles per hour speed restrictions were implemented in Edinburgh and Belfast. In Edinburgh, 20 mile an hour speed limits were introduced citywide, and in Belfast the scheme covered only the city centre. The aim in both places was to create safer roads with fewer collisions and casualties. The schemes consisted of signs, awareness raising and enforcement. In this second short film, we look at what impact the intervention had in the two cities. We began by considering the evidence, but also listening to people who knew about speed restrictions. And we gradually built up a picture of how things might relate to each other. You can see it here in a still from our very first brainstorming session. It looks pretty complicated. Although it looks like a lot of things are involved and affect each other, we found that we were thinking pretty well in straight lines. Our idea was that there was an input, changing speed limits, and there would be outputs. Traffic speed would slow down, and this would make the streets safer. We also thought there would be an increase in people walking and cycling if streets were perceived to be safer. We thought in terms of moving through time from left to right on the diagram. In fact, it is a complex system, and we needed to understand that complexity in detail. We realised that speed restriction was not one thing. So it is not one input. It consists of engineering measures, of signage, of public education, and of police activity. It consists, in other words, of all sorts of things done by different individuals and authorities. These things have possibly quite different effects, and they affect each other too. And they don't necessarily happen all at the same time, and so the effects are likely to be different at different times. This makes researching it quite tricky. There are then few easy answers for scientists or policymakers. We realised that if the goal was to make the streets safer, to encourage more walking, to improve air quality, and to encourage more cycling, there was a lot going on, and we would need to try to disentangle these different things. So we had to refine our model. We built a program theory to show all that we thought we knew from the evidence about these factors and how they worked together. This shows a whole variety of links between things going on in Edinburgh. So, for example, between the council in Edinburgh, Police Scotland, and neighbourhood partnerships. This was really helpful because it allowed us to plan our data collection and organise the information we already had. When we had finished our investigation, we found that in Edinburgh, the number of collisions in a year reduced by 367, a 40% reduction. There were 409 fewer casualties, a 39% reduction. In Belfast, we found that the volume of cars within the city centre each hour reduced by nearly 40%. People also thought the city was a nicer place to live afterwards. On collisions, there was a 2% reduction and 6% reduction in casualties in Belfast following the introduction of the 20 mile an hour speed limits. We found that in Edinburgh, of every 100 cars using roads in the areas where the restrictions had been introduced, 45 travelled above 25 miles per hour before the intervention, whereas afterwards only 31 out of 100 were doing so. In Edinburgh, 12 months after the policy change, average speeds on the roads in question had been reduced by 1.34 miles per hour. In Belfast, speed fell by about 1 mile per hour. Now bear in mind that the average speed before the intervention in Belfast was already close to 20 miles per hour. We also studied the way the schemes were implemented. In practical terms, a number of things were important. Implementation was broadly delivered as intended in both places. Only minor amendments to implementation were made during delivery. For example, changes to the signage made in response to public feedback. A joint education and awareness campaign was delivered from the outset of implementation in Edinburgh, with dedicated staffing and funding. In Belfast, it was actually much lower key. There was a good deal of public awareness about the 20 mile per hour scheme in Edinburgh, therefore. In contrast, a lack of awareness of the 20 miles an hour speed limit initiative was found among the general public in Belfast. There were no major changes in the way the police managed traffic in either city. When it happened, enforcement was often reactive in nature and in response to public complaints. This then had a focus on the education of drivers, which of course is in line with how other speed limits are enforced. The idea was that speed restrictions like this should be self-enforcing and non-coercive. Interestingly, this was found to be at odds with the way the public thought the police should behave. Enforcement activities were perceived by the general public in both cities as being insufficient. Some members of the public in Belfast thought that driver behaviour got worse. In Edinburgh, the public didn't report that 20 miles per hour speed limit initiatives led to any increases in journeys made on foot or by bicycle. Speed restrictions are a multi-pronged intervention, reaching across many administrative departments, whether locally or nationally. They are not quick fixes and do not bring obvious immediate results, such as more walking and cycling. But they do change how vehicles move through urban space. They do lower the number of accidents and casualties. And they improve the overall environment in ways that are likely to be beneficial to pedestrians and other road users. Reductions in speed are important, though not just because there are fewer road traffic accidents, even though there are. Slower speeds make things less dangerous for everyone. The human body is a fragile thing, and if it is hit by a lump of metal, glass and plastic, travelling at 30 miles per hour and above, the damage to human tissue is enormous and potentially fatal. With every, even slight reduction of speed, the potential for lethal damage to pedestrians and cyclists also reduces. This is a real gain for population health. The measures taken in Belfast and Edinburgh achieved this.